How to manage pain after intestinal obstruction surgery. Have you recently undergone intestinal obstruction surgery and are wondering how to manage the pain that comes afterward? You're not alone, and there are effective ways to help ease your discomfort. Let's break down some practical steps you can take to feel better during your recovery. First, pain medication is often prescribed to help control discomfort after surgery. It is essential to follow your doctor's instructions on how to take these medications. If you notice that your pain is getting worse or not improving, be sure to reach out to your healthcare provider. This could be a sign of complications that need attention. Regular follow-up appointments are crucial to monitor your healing process and adjust pain management as needed. Next, dietary adjustments play a significant role in your recovery. After surgery, your intestines need time to heal, so starting with a low-fiber diet can be beneficial. This helps reduce strain on your digestive system and minimizes bloating or gas, which can worsen your pain. Gradually reintroduce foods to see how your body reacts, especially if you have irritable bowel syndrome or colitis. Avoiding irritants like spicy foods, caffeine, and high-fat meals can also prevent additional discomfort. Managing bloating and gas is another important aspect of your recovery. These symptoms are common after surgery and can lead to increased abdominal pain. Gentle movement, such as short walks, can stimulate bowel function and help reduce gas buildup. Staying hydrated is equally important, as drinking plenty of fluids aids digestion and prevents constipation, which can add to your pain. It is wise to avoid carbonated drinks and foods known to produce gas. Finding the right balance between activity and rest is essential. While it's important to rest, too much inactivity can slow your recovery. Short, frequent walks can improve circulation and help your digestive system. However, avoid heavy lifting or strenuous activities for several weeks to protect your abdomen and surgical site. Taking care of your incision is also vital. Keeping the surgical area clean and dry helps prevent infections that could lead to increased pain. Watch for any signs of redness, swelling, or unusual discharge, and contact your healthcare provider if you notice anything concerning. Monitoring your bowel function is another key part of recovery. It may take time for your bowel habits to return to normal. Passing gas is a good sign that your bowel is recovering. However, if you experience constipation or diarrhea, it is important to manage these symptoms with guidance from your healthcare provider, as both can contribute to abdominal pain. Lastly, managing emotional stress can be beneficial. Stress can worsen symptoms of irritable bowel syndrome and colitis, potentially increasing your perception of pain. Techniques like deep breathing, relaxation exercises, or gentle yoga can support your overall well-being during this time. By focusing on pain control, making dietary modifications, managing bloating and gas, balancing activity and rest, caring for your incision, monitoring bowel function, and managing stress, you can navigate your recovery after intestinal obstruction surgery more comfortably. Remember, always consult with your healthcare provider for personalized advice and support during your healing journey.